Hello and good afternoon, everybody. Thank you guys so much for showing up to this virtual world. My name is Laura Calvert. I am an HIV health educator here at the Gwinnett, Newton, and Rockdale County Health Departments. We are having a chat today about women's health. March is National Women's History Month. So we want to bring a lot of our experience, our expertise, and talk about some important issues, especially HIV. That's a lot of our bread and butter here. So we want to share some information with you. This conversation is open to questions. So if any of you guys, as you are listening, have questions about anything that's said, want to know more, go ahead and drop it in the chat. You can message me, you can message any of our panelists, and they will be more than willing to answer them, okay? So let's just jump into this with introductions. I am going to have all of these ladies introduce themselves. So would you mind sharing your name, your agency, and what you do in the community, and what are your passions? Okay. Does anybody really want to go first?
I'll start first. Hello, good everyone. My name is Dorian Freeman, and I am the Clinical Infectious Disease Program Director with the Gwinnett, Newton, and Rockdale County Health Department. And my passion is anything infectious disease. I currently oversee our HIV, TB, and STD programs. So prior to joining GNR, I worked for more than 17 years as a women's health nurse practitioner. So my passion is working with adolescents and young adults with a focus on STD prevention and really kind of advocating and educating the community. And public health is my passion. And so I am definitely honored to be here and hopefully can share my expertise today and further our cause in preventing infectious diseases, like I said, which is my passion. So honored to be here this evening.
Thank you so much, Dorian. Heather, you're unmuted. Would you like to go next?
Sure. So my name is Heather Kapuna. I'm a program specialist here at Center for Pan-Asian Community Services, or CPACS. Basically, we're an agency that is on the belief that people need people. CPAC's mission is to promote self-sufficiency and equity for immigrant, refugees, and underprivileged communities through comprehensive health and social services, capacity building, and advocacy. My passion is basically working with the refugee and immigrant communities to ensure like health equity is achieved, that everybody has access to care and to have the best health outcome. So.
Amazing, and thank you, Heather. We're so glad to have you. And then last but never least, Lavanzia.
Hello, and I'm so happy to be here, to just be with just such great people who are interested in the same things that I'm interested in. So my name is Lavanzia Mawa. I'm the Infection Control Coordinator for Viewpoint Health. We basically do all the education and testing for HIV, hepatitis C. We actually do a lot of outreach. We basically go in the gutters, as I say, and we go out there and we get them. Especially ones that won't come to us. We service a lot of indigent clients, the uninsured. So we deal with a lot of substance abuse and mental health in the Gwinnett, Rockdale, Newton areas. Actually, we do some Fulton County, DeKalb, and Henry County. So, and we're just very client-centered and just in helping the needs of the client. I think I'm very passionate when it comes to outreach. I think it's one of my passions because I feel like dealing in the mental health, we have a lot of clients that suffer from like schizophrenia, anxiety, paranoia, dual diagnosis, clients that we have. And sometimes it's just really, really hard to get them to open up and to reach. So I think just going out into the communities, I've just kind of gained a real passion for that and being able to go out and test as well. So thank you.
Boots on the ground. We love to see it and we need so much more of it. So thank you so much. Thank you, all of you. So I'm just gonna get right into it and jump into these questions that I have. So I just want to remind everybody, as we're answering these questions, being a woman is not a monolith. We come from so many different backgrounds, so many crosses of backgrounds, so many intersections, okay? So as our panelists are answering these questions, it is oftentimes coming from their own personal experience, from their own educational, academic backgrounds. So if something you hear you may not agree with, that's okay. But all of these women are very much the professionals in their fields, okay? So to make it a little bit easier, I want to start with some true or false questions, okay? Doing HIV education, doing HIV testing, talking to the community all the time, I get a lot of misconceptions, okay? So I'm going to start asking you guys some true or false questions, okay? So I'll direct them at you guys. So the first one I have is for Dorian, okay? True or false? Well, answer this for me. HIV and other STIs can only be transmitted when symptoms are present.
So that is definitely false. And I know that's a misconception. So a lot of individuals feel like, well, I don't need to go get tested for STDs because I'm not having any symptoms. When actually most people do not have symptoms. So that's why it's very important that you advocate for yourself. When you're going to your doctors, when you're going to whether it's your primary care or your OBGYN, understand your risk that anyone who's sexually active, there is a risk. There is a risk that you take. We know that abstinence is the only thing that can 100% prevent pregnancy, can prevent STDs. But when you make that decision to become sexually active, then we have to take a responsibility among ourselves and say, okay, let me be proactive in my care. So you don't want to wait until you have symptoms, because you can go weeks, months, a long time with having an STD such as gonorrhea and chlamydia, and you may never have any symptoms of it. So I would advise you to, when you go to your doctor, advocate and know that if you're sexually active and you have not been tested, especially if you're under the age of 26, you should get tested, you and your partner, for STDs once a year. And that's truly the way to make sure that you don't have any STDs. If you're engaging in riskier behaviors, then definitely, of course, you want to get tested more often than once a year. Such as, and when I say riskier behaviors, maybe you're having sex with multiple partners, maybe you're having unprotected sex. So you want to be proactive and know what resources and tools are out there to protect yourself. But you definitely don't want to wait till you have symptoms and think that if I don't have symptoms, then that means I don't have an STD. Usually men will more likely have symptoms of an STD before women will. But most women do not have symptoms of an STD. Definitely, of course, if you have any issues or concerns where you feel like, okay, I'm having an abnormal discharge, discharge is definitely normal in women. But if it has an odor, if you have itching or anything like that, then that's not normal, and you want to make sure you follow up. So, and then when you follow up in the office, you can determine, based on your sexual risk behavior, we can identify what resources are out there for you. For instance, we definitely want you to make sure you're using condoms. We want to make sure you're getting tested for HIV. It's important to know your status. It's important to know if you have any STDs, because definitely, of course, if you know your status, you know that you're negative, to know your partner's status is also important. If you test positive for HIV, then we can get you into treatment. And then that's very important, because that can reduce, your chances of continuing to transmit that infection or HIV to your partner. If we get you on medication and you have an undetectable viral load. There's also other HIV preventative tools that we have, such as PrEP, which is a medication that you can take to prevent HIV if you're at risk for HIV. So just understanding that you have all these resources and tools out there, and advocating for yourself, so that, when you see a healthcare provider, you explain we can review your history and determine what's going to work best for you and keep you the healthiest.
Okay, so I have two follow-up questions to that.
Right.
As a patient and coming to a clinician, a lot of times there's a lot of shame and stigma surrounding STI testing, getting treated and getting tested. Would I need to worry about that? Should I worry about that?
You don't need to worry about that. And I know it's a difficult decision. And it's hard coming into a provider and someone, maybe you've met them for the first time, or maybe you only see them once a year. and you kind of feel like, I don't feel comfortable, you know, talking to this person about my most personal issues or about my sexual history. But know that that is what we're here for. And there's nothing that, you know, is surprising to us. When I worked as a healthcare provider before joining GNR, I love the honesty of my patients and sitting down, because I can be the best provider. You know, I want to make sure that you're receiving the services you need and that you walk away with a better understanding of, you know, what your risks are so that you can protect yourself. So I know it's uncomfortable, but definitely, you know, it's confidential. That's not any information that's shared with anyone else other than the people who are providing that care for you. But I would say you want to have that open dialogue and an honest conversation, because like I said, we want to make sure that you have access to the resources that you need to protect yourself, to protect your partner. So like I said, even though it's an uncomfortable conversation, we have your best interest at heart. But if you don't disclose that information to us and you're not open and honest, then it may limit the resources, or we may not even provide those resources that you need to protect yourself from STDs, including HIV.
Well, that answer made me feel very comfortable. So don't be surprised when I pop by your office with more questions.
Definitely, anytime.
And we kind of touched on a little bit of stigma and shame. So Lavanzia, I wanted to ask you this question. True or false? Can you tell if somebody has HIV just by looking at them?
Of course, that's false. You cannot tell by looking at someone if they have HIV, but even as we are in 2021, I realized that people actually still think that. So surprisingly, we actually get that a lot when we're educating in the groups that we're educating. And I hear it a lot from clients. They'll say, oh, well, I can tell if such and such has it. And they go off of some of those old 80s and 90s symptoms that we used to say, you know, oh, if you have this breakout, or if the person is thinner than usual, and things of that nature. And one of the things that we're constantly reminding them is that you cannot look at anybody and tell what they have. You are not a walking around radiology system that you're just looking into someone's body. But unfortunately, people still think that, and that's still associated with people's mind, that if you display a certain type of symptom, I can tell. And picking up back off of what Ms. Dorian said when she said about as far as smells and things like that, I bring up a lot. They'll say, oh, well, I can smell something. I'm like, well, you know what? If there is a smell, then that is an indication that your body is telling you actually that you need to go get checked, that there is something wrong when there's something that's smelling, or you smell a certain odor that's not familiar, that's not right. And so we get that a lot, but that is definitely, you can never look at someone and tell whether or not that they have HIV, whether it's anything. Just please know your status, go get tested. So that's one I push a lot. You cannot tell by looking at someone what they have.
Yes, we cannot repeat that enough. Please get tested. Know your status, share your status. Bring somebody to get tested with you. That is the only way we're ever gonna know, okay? Heather, this question also comes up so frequently, especially when we're testing. True or false? Only certain people can catch HIV or have to worry about HIV.
Again, that is false. We see this a lot. It's relevant in the refugee and immigrant communities. That also see that we don't see a lot of engagement or participants in HIV testing from the community that we work with. They believe HIV is not relevant to them, and therefore only affects a certain number of people. But recently, we've been seeing a lot of people getting tested for the first time when we did a combination of COVID-19 and HIV testing. So we're definitely seeing an increase, and people kind of countering that misconception.
That is an amazing strategy. Everybody wants a COVID test. Nobody wants an HIV test. Marrying them, perfect. Lavanzia, did you have anything you wanted to add to that true or false question?
Well, when you're talking about just getting tested and knowing your status, I think in actually the African American community, as far as we are at Viewpoint Health, we have still a lot of stigma, especially from our mental health community part. That just culture of people are still not comfortable with getting tested and using those combination strategies. A lot of times, like if we're testing for one thing, we'll try to basically bring them in to test for another, or just try to appeal to them like, hey, you're already testing for this, so you might as well come in and test for that. So I love when Heather said that they're using those same strategies to kind of basically get people into testing, and just knowing your status. It's just so important. And yeah, that's pretty much, we deal with the same issues, basically. Yeah, that's the same fight with us as well.
And you're going to hear it again a million times. Just go get tested. That's our easiest, best way. And then my last question is going to be back to Dorian. You touched on this a moment ago, but I have a lot of people that come in and say, oh, I'm on PrEP. I don't have to use condoms. True or false?
So I commend that person who feels that way, and I commend them to the fact that at some point they discussed with someone about their sexual history and determined they were a good eligible PrEP candidate. And we know that PrEP is 99% effective in preventing HIV, you from acquiring HIV, if you're taking PrEP correctly, meaning it's a daily medication. Or for those who don't know what PrEP is an HIV prevention medication that is prescribed by a healthcare provider. It's 99% effective in preventing you from getting HIV if you're taking it on a daily basis. But it does only protect you from HIV. So if you're sexually active with other partners, it does not prevent you from getting other STDs like gonorrhea and chlamydia. So we still do recommend that you use condoms. Condoms are a highly effective HIV preventative and STD preventative tool that we have in our toolbox. So not only do we recommend you get tested and know your status, that's one of those effective tools we have in our toolbox, but we also want to ensure that you're using condoms. We do know, like I said, it's highly effective in preventing gonorrhea and chlamydia, certain bacterial diseases. It's not as highly effective at preventing diseases that cause ulcers and sores like herpes, herpes and syphilis, HPV, but it can still be effective against those things. And it's less effective mainly because there's still skin-to-skin contact, even with condom use, but it's better than not using anything at all. So even if you are on PrEP, you still want to make sure you're using condoms to prevent other STDs other than HIV.
Awesome. So one way is good, 2 ways, even better. Good.
Definitely.
Okay, so I feel like you guys cleared up some misconceptions we had. So now I want to get into some information about your lines of works and the communities you service. So what kind of issues are you seeing in your line of work that greatly affect the women in your community? And then how can we alleviate those issues on both a personal and a community level? So who wants to dig into that one first?
First,
Okay.
I think at Viewpoint Health, for us, because we do service mainly a lot of the uninsured, it's access to health care. Like a lot of them are indigent. I think the second thing is mainly fear. On the mental health side, they come from a place of just fear and untrusting. Like, so we have to deal with that. Once again, when you're talking about the mental health community and you're dealing with people with dual diagnosis, you're dealing with people with a lot of paranoia and anxiety. That is one of the issues that we deal with. And kind of back to the cultural thing, because we service everyone and we are a full service organization, we definitely deal with things just inside the culture where people just don't trust you, and then they're like, well, I gotta pretty much disclose everything I got to people that I don't know. Mm-hmm. Who comes back and still, I already feel that I don't have the money. I came here with no money, just hoping to get a little bit of help. And I think that part of our issues right now is it's housing, just not having certain resources that we need. We just cannot basically put everyone that comes in up into a housing. And a lot of times they're not in a comfortable space. They're not in comfortable places, and they've relapsed. Let's say I'm dealing now with a few clients who might have relapsed, might have came off their HIV medications. Family don't pretty much talk to family anymore. Family has pretty much ostracized. I mean, they're totally don't have mom, dad, sisters, brothers, aunts, anyone, and they have nowhere to go. So we deal with that. And a lot of times with partnership and that with you guys have been such a blessing for us, because a lot of times I've tried to really go in and get a report with certain people where I can say, hey, this particular client don't have the financing, but they need that STD panel.
Mhm.
And there, because we and you guys will really do it on a sliding scale, and that's what people need to be educated on, that if you go there, they might, and they may or may not have the funding at that time. But I literally can say I've sent clients to Department of Public Health, and they came back and said they actually said they had a grant there and I got it for free. And I'm like, I get so excited because the client wasn't expecting that. And that kind of brings together that when they're not so trusting and not so forthcoming, and now they feel like you're actually helping me. You know what I'm saying? Like, nothing's free, but this person is actually helping me, and it makes me feel so good that when we can kind of come together and do that. Or if they come back and say, hey, it was $20, I got a full STD panel, I was able to get my HIV testing, my hepatitis C. The people were so nice, and they were just, I was able to really talk to them, and that always helps me. And but those are our issues, just basically access to healthcare, housing, just basically kind of getting people to come in and be able to trust us just to help them.
What would you recommend that somebody could do on the individual level? So just me as a community member, seeing some of these issues, what can I go out and do to help?
Um, I think one of the biggest things, I'm really in on educating, actually getting out there and outreach and educating, getting in the streets, because a lot of times they are embarrassed and they're not going to come where we're at. So sometimes we do have to get out and go and really kind of educate the misinformed. I think a lot of people are still misinformed in our personal communities. They're just really misinformed. The families are misinformed. So as much as like family group therapy, I try to say, hey, we're going to start this group, you guys, bring your families, bring your friends, any support system you have, because I feel like we have to educate the misinformed. That's one big one. I know earlier when Ms. Freeman brought up PrEP, a lot of people still don't know about PrEP. They don't understand that that is available. They don't understand that you're going to live a normal life expectancy. This isn't a death sentence. You're going to live normal. They feel like everything is ripped apart. If you tell them they have anything, it's just, my whole life has been ripped apart. We can't date anymore. We can't do this. And so just being, just educating, I think dispelling a lot of those rumors that are out there, and dealing with the mental health. A lot of times I try to get them as far as like dealing with their daily stuff, like believing in self again, doing self affirmations, breathing, meditation. So in a lot of our groups, we teach a lot about meditating, doing affirmations. What is one? Basically journaling, meditating, just kind of building up that self-esteem and doing a lot of self-care. So I mentioned that a lot when I'm talking to people on outreach, like, what do you do when you get those anxieties and stuff? Are you doing self-care? Do you have a journal you can write in? Do you have someone you can talk to? Is there someone you close to? If you like, you talk to me, and just seeing someone who looks like them, that's out there, that they can trust and believe in. I think it's been very healthy. And you guys have been awesome, I can say, on that front. Like, anytime we need condoms, and I can slide them some bag of condoms, or dental dams, lube. I mean, just anything that can actually promote prevention, helping them out with PrEP. If they don't have a place to go, you guys will help me find a place that they can go. So I think just doing what we're doing and doing it more, getting better at it, just out there educating and doing what we're already doing. Yeah.
I don't know if any of the participants noticed that as soon as Lavanzia said that we need to educate, we all started bobbing and nodding our heads. Sharing is caring. It may feel weird to go get an STI test, an HIV test. Tell your girlfriends. I know my girlfriends are sick and tired of me telling them that I got an STI test, but I'm going to tell them every single time. So when one of them feels like maybe something might be wrong down there, that they might need to get tested, I'm a friend that they can go to and find out more information, figure out where they need to go. Okay. So sharing is caring. Tell the world what's going on, how you're feeling, what you're doing. Heather, I'm going to ask that same question to you. What kind of issues are you seeing in your line of work that are greatly affecting the women in your community? And what can we do to alleviate those?
Yeah, so in our community, we work a lot with the immigrant and refugee communities, and the topic HIV is still taboo. There's still some shame around it, but we have seen some improvement. Most of our women, they're facing pretty much, they're trying to focus on putting food on the table and getting vaccinated for COVID because since the pandemic, a lot of HIV topic is put on the back burner again, but again, it goes along with educating, continuously going out there, just showing face, just being there available for them, continuously letting the community know that we're always here to provide the services. And also, I think in-language assistance is also a big thing for us. We provide education in multiple languages and having that available to counter, cultural awareness. And
Yes, I think language barriers can often be not just for people seeking services, but for people providing services. Because I would love to teach everybody that I can, but I know when I can't communicate, I really struggle. I've gotten very familiar with our language line, and I love using some Google Translate. So I try not to let anything stop me. So that's a very good point to bring up. But me as a community member, if I was servicing some of the population and maybe I'm not familiar with any of like maybe the cultural differences that we might have, even the language, what can I do to better myself to help people?
just providing any language assistance, reaching out to other community organizations, seeing if they have any resources available. Like for CPACs ourselves, we have our information or education translated in about like 10 different languages. So definitely I feel like there's always going to be somebody who will have it, and definitely reaching out to different organizations.
Every time you come across a barrier, there is some organization that can help you overcome it. We just got to do a little bit of Google search.
Yes.
Thank you, Heather. And then Dorian, what issues are you seeing that are affecting the women that you serve?
I will say the most important, the issue that I'm seeing, or a major problem that I'm seeing, is just the disparities that we see when it comes to STDs and HIV. And we know that no one is exempt from STDs. No one is exempt from HIV. It does not matter your sexual orientation, your race, your ethnicity, your age, or your gender. No one's exempt, but understanding that the most important thing is, trying to educate yourself and us trying to educate the community so that they know what resources are out there. And even if you've read up and you don't understand it, and you don't have to have all the answers. You just need to know who you can go to get those questions that you have answered, so that you know how to best, provide the best care for yourself. And like Lavanya said, we know here at GNR, we do provide services at the health department. So we have providers who you can come in if you have questions about, what are the best options for you based on your sexual behavior, risk behavior, not being ashamed of that, but understanding that that's what we're there for, so that we can discuss these different HIV preventative measures with you. And also getting you tested, because we are seeing an increase in women. We know that STDs can cause infertility. So we know that could later down the road, prevent you or making it harder for you to get pregnant. We're seeing increased number of people who have syphilis and babies that are born with congenital syphilis. And these are things that can be prevented if women come in and they get the STD testing that they need. We're also seeing disparities across out with the use of our preventative tools, such as PrEP. Looking at the individuals who have an indication for PrEP, we see that the greatest indication is usually in African American and Hispanics. But based on the prescriptions that are being written, there's a low percentage of prescriptions that are written in those populations. So we know that there's definitely a gap. And why is there a gap? Lack of education. I mean, I even asked a couple of my family members today, like, do you know what PrEP is? And they were like, PrEP, you mean get ready, like prepare for your food or your, so I think it's just education. We really need to get out in the community. And when you're educated as an individual, then extend that education to others, and that's how we can make the difference in the community. And then after I asked them, and I was like, no, the medication to prevent HIV. And they said, oh, I've seen commercials. So sometimes that's people's only way of even knowing about PrEP and knowing about what preventative tools we have out there is commercials or what we're doing in the community. So you don't have to have all the answers. At GNR, we're here for you. If you're concerned about insurance, if you're concerned about not having the money to come in for a visit, or if you're concerned about not even having the money for PrEP, there are services that we can provide that assist with it. Like I said, we provide services on a sliding scale, and we're willing to work with you and help you if you're interested in getting PrEP. You may say, oh, PrEP is not for me. PrEP is maybe only for gay men or bisexual men. Well, keep in mind that 24% of the new HIV diagnoses every year are from heterosexual contact. So we know that we're all at risk. And when we look at PrEP usage among women, of all the prescriptions that are written, only 4.7% of the almost 80,000 prescriptions that were written in 2016 were women. So we know there's definitely an underutilization of PrEP in women. So definitely we want to change that. I want to change that. And the change starts with you, getting yourself, becoming more familiar and educated about PrEP. Reach out. That is what we're here for. We're here to help you take care of yourself and provide the best services we can to protect you, your family, and protect your partner.
And if any of you guys watching or listening have more questions about PrEP, we have a fantastic PrEP coordinator here, Miss Phyllis Moore. Marty put the link in the chat, so you can always go to our GNR Health website and learn more about PrEP services. You can get in contact with Phyllis, and she will definitely have that information for you. But you made some brilliant points, Dorian. Thank you.
Thank you.
And then so a lot of times with health, I know me, I'm very on top of my health. I go to the doctor's office with a sticky note with like 1,000,008 questions that I need to ask whenever I go in there. But if I ever forget my sticky note, I will just sit there with my hands folded, stick poked, weighed, and then at the end, do you have any questions? My mind is completely blank because I'm panicked. I'm in a doctor's office. I'm in a clinic. I don't know what to ask, who to ask, or what. So what kind of tips do you guys have for advocating for oneself at a doctor's office, or if I'm going in to seek any kind of social services or any services that your organization would offer? What can I do to better advocate for myself as a woman?
I would think that make a list of like your concerns that you have. Remember that you know your body best. You know what's going on with you. I think that's a key thing especially for women. I think we as women, we know our bodies a lot more. Well, maybe I'm more partial, but I always say we know our bodies a lot more better than the men do, but we definitely do. We know our bodies. So I think make a list of your concerns, jot down how you feel. Don't be afraid to explain and really advocate for yourself. Like not being afraid to say, hey, this is what's going on. What do you recommend I do? that's what I'm normally doing when I get ready to go to the doctor. I'm like, okay, this went wrong, that went wrong, this wasn't normal, that wasn't regular, and how do we regulate this? And I think just not having a fear to actually talk to your doctor and explain. And then if he's not for you, sometimes it's time to find another one, because that doctor literally should be supporting you and should be basically listening to your concerns. So definitely just advocating for yourself, writing those concerns down so that we don't forget it. And then we get home and be like, I wish I'd have told him about this and that, and what would work best for you. And so I think that's very, very important. And if you're on a medication that's that you feel that your body is not reacting to right, don't be afraid to mention that to your doctor. Like you said, Laura, that's what they're there for. That's what we're all here for. Please let them know this isn't working for me. My body doesn't feel right with this particular medicine. This is happening to me. And just really advocating for yourself and being your own voice. So I think that's really important when you're going to the doctor's office.
You're paying that copay. Get your money's worth.
Okay.
Yes. Heather, do you have any advice?
Yeah, to piggyback off of, like, don't be afraid to ask questions or ask for the language assistance. Some of our clients are limited English proficiency, and when they go in, some of the information is lost and the patient misinterprets or gets misinformed. So we definitely encourage to ask for language assistance, and for clinics also to adopt a language assistance program if you don't already have one. And definitely just, yeah, advocate for yourself, ask questions. I know when I go into the doctor, I ask 1,000 questions. I make sure I understand everything before I leave. So yeah, don't be afraid to ask those questions and really advocate.
Yes. And Dorian, do you have anything to add?
I would just say again, like I stated, educate yourself, but don't feel like you have to come in with all of the answers or all of the right questions. As providers, and I know as being a provider myself, you want to be able to take the time, and hopefully you walk away from that appointment with a better understanding. That was always my goal, that, maybe something I said, could make a difference. Maybe something I said, if even it was just to one person, and understand that as healthcare providers, you're not telling us things that we haven't heard. We're not sitting there going, oh my God, I've never heard that before. So understand that, we're there to make a difference in your life, and also to make it a great experience for you. We know, especially, being an OBGYN, nobody wants to go to the OBGYN. It is an uncomfortable situation already in itself. And so now you're undressed and you're talking to someone about your personal issues. And we understand that is very difficult, but that is what we're there for. We have a passion for it. And we want to make sure that you're getting the best care that has the greatest impact on your life and on your health. And that's the most important thing. And yeah, can you go to a provider and you don't feel like you're getting that? You feel like you're getting rushed? It happens sometimes. And I would even say in that instance, and I probably would too, then that provider may not be for you. But don't take that experience and say, okay, I had one bad experience, I'm never going back ever again. Okay, so just understand that, there are many of us who are passionate about it. I know our providers at with the Gwinnett, Newton, Rockdale County Health Department, we're passionate about what we do and about having the greatest impact in the community. So, if you have questions, please reach out to us. And we're here. And I always tell people, there's no stupid questions, just ask your questions. Don't feel like, okay, that's stupid, or they've never heard that before. That's what we're here for. We're here to educate you and empower you so that you can take that information out in the community and have the greatest impact out in the community.
And I want to point out that this panel right here is a small sampling of clinicians, of outreach workers, of people that are serving their communities. And this is a judgment-free zone. And this is a very good representation of what it's like to receive medical treatment, to receive care. A lot of the time, we're internalizing shame, stigma, a little bit of worry about health conditions. But look at all of us. We're like, just come to us. It's okay. Bring what you have. We will try and help you. We'll find who can help you. So if whatever you take from this, just know that you're not being judged. We are here to help you, okay? All of these women, their organizations, we're here for you, okay? Um, is there anything else? Those were all of the questions that I had for you all. Those were like beautiful, above and beyond amazing answers. Is there anything else that you would like to leave our viewers with in during this women's health dialogue? Any closing statements?
I would say that just letting people know that we've made great gains in the world of HIV. I mean, these have been 40 long years, but we have came a great, I mean, no one would have thought, I'm old, you guys. So no, I would just throw that out there. Like, I literally remember when I was an adult when HIV pretty much hit the scene. So saying that, meaning I knew the fears, the stigmas, just everything that went into it, and to see where we are now, and to tell people that you deserve that love and that attention. You deserve that. And I think Ms. Freeman said it earlier, like it doesn't discriminate. Like, it can hit any of us at any time, and have hit different people of all different walks of life. I mean, there's no certain type of people anymore, and just you deserve that. You deserve that attention. Sometimes you have to be your own voice. Sometimes you even have to be someone else's voice. And I've seen that. I've seen clients who I've had to grow from being their own voice to other people's voices. And I'm just in the back like, yay, like they're like Lavazia, they don't know, and they're not educated, and they're not informed, and we teach this, and this is what it's about, and we're growing and we're developing. And I just want to say, I do believe in our lifetime that we are definitely going to see a cure for this. And I just love that people are living their normal, healthier life, and they're speaking out, and they have a voice. And I just think that's awesome, and that we as women can come together and just really just advocate and be there for each other, and know that now we finally got a voice with this thing, you guys, and we're getting reps. I mean, we're helping each other, and that just blesses me when I see that, because it has been a long and a hard road, but to see, I feel like we're just at the tip of that thing. We're gonna get it, but just letting people know that you do have a voice, and you deserve to be treated with respect and dignity, and regardless of stigmas, just know that those people, they're misinformed, that you can live a healthy life, and you will live a healthy life, and we're out here to help. We're out here to serve. And like you said earlier, Laura, just come to us. Please know that we're open. Use those numbers that you're going to list, and know that for mine, it is definitely, I keep my cell phone on all the time. Like, a lot of times we say those hours are 9 to 5. I swear I'll have somebody call me at 6, and I'm like, oh my God, that's client such and such, and I don't want them in. So we're very passionate about what we're doing. We're here for you. And just, if it's just a listening ear, please just call. And if I can't do it, if I don't know it, I'll try to make sure that I can find someone who does. And it's just about, and earlier when Heather said, even if there's a language barrier there, if I can't get to you, I'm like, hold on, I'm about to find somebody. I'm about to Google somebody who can speak this language, so that they can help us and they can bridge that gap. So, I just thank you for being here, and for just putting all of this together, and us together, and just having a voice for our own communities. Thank you for that.
Thank you. I feel empowered. Like, I'm gonna go to the doctor tomorrow, and I'm gonna talk to them. I'm gonna Heather, is there anything that you want to leave everybody with?
Yeah, just again, just advocating for yourself, knowing that there are organizations available, that that we are available. You can contact us anytime. Most of our staff are multilingual as well. There's going to be somebody there for you, so definitely reach out and just be a voice for yourself.
Yeah. And Dorian, any final comments?
What I would say is, I would encourage everyone, if you're at risk for HIV, to talk about these preventative tools we have. Testing, know your status. If you have not gotten tested, you don't know your status, you don't know your partner's status, get tested. And you may be sitting there shaking your head going, I'm not at risk for HIV. If you're sexually active, you're at risk for HIV. If you're an IV drug user or you have a partner who's an IV drug user, you're at risk for HIV. So know that, you know, it's not just gay and bisexual men. It's not certain types of people. And I don't want you to say, oh, I don't have to worry about that. Talk about it. We want to talk about it. We want people talking about it. We want you talking about testing and using condoms. And we want you to talk about PrEP. If you've ever had an STD or you've had an STD in the past 6 months, you're a candidate for PrEP. If you've not consistently used condoms, if you've had an episode where maybe a couple times you haven't used condoms, you're a candidate for PrEP. If you have a partner who's HIV positive and you don't know if they are on medication for HIV or they have an undetectable viral load, which would mean they can't transmit the HIV, if you don't know that about your partner, then you're a candidate for PrEP. If you're, like I said, an IV drug user, or your partner is, or you share syringes and needles and things like that, you're a candidate for PrEP. So let's talk about it. Let's talk about what we can do so that you can protect yourself and we can eliminate this HIV epidemic because all of these infections are preventable. And know that, and that's what we're here for. We want to prevent additional infections.
Yes, yes, yes. Everybody's mentioned contact me, call me, email me. So I am not going to leave you all without that information, okay? I am going to share this little, this is everybody, all of the participants' contact information, okay? So if you want to reach out to anybody, go ahead, take a little picture, write it down, keep that up there. I'm going to open up the chat box to questions. Does anybody have any questions that they would like to direct at any of our participants? Just any general questions, those are always welcome. And as you guys are chatting, I wanted to put you guys on a little bit of game, some not so well-known GNR health secrets. We'll mail you condoms, okay? So we're in COVID. I know I've had my vaccinations. I don't want to go anywhere but work. I want to stay in my bubble, but I also want to stay safe. So if you live in Gwinnett, Newton, or Rockdale counties, you can go to our website and we will mail you condoms, okay? We will send you every single month. We will send you 3 months, whatever works for you, we will do that. And if you don't live in any of our service counties, check out your health department. I know that Cobb is doing it. I know that Fulton is doing it. So if you're outside of our service counties, just search around, see what information you can find. Also, Georgia Department of Public Health is offering free self-testing, okay? So we all know there's tons of barriers to going in to get tested. A lot of people get a little bit nervous. They don't want to see somebody at the clinic. They don't want people to see them at the clinic. That's perfectly fine. We have programs where we can actually mail you HIV tests. We'll mail you 2 HIV tests. So you take one, your partner takes one, your roommate, your best friend, just everybody get tested. Marty dropped those links in the chat if you are at all interested. If for some reason you need to go back, shoot me an email, call me. I'll hook you up with all of the links, okay? We do have a question in the chat. So I am going to shoot this off to our panelists. We have a question. How can Black gay men, HIV advocates, help in the fight for women and girls living with HIV? Awesome, thank you. The graphic is really cool. Does anybody want to take on that question? How can Black gay men, HIV advocates, help in the fight for women and girls living with HIV?
I think just providing support, coming alongside and providing support and sharing experiences so that they know that they're not alone. Also, you know, to encourage them and let them know that they can live a normal, healthy life as long as they, you know, are on medication with the goal of having an undetectable viral load. So I think just educating and providing that support will be major in coming alongside of women and girls who are living with HIV.
Anybody else want to add on to that?
Absolutely. I was going to say that kind of the exact same thing. Just kind of being that support, being that shoulder to lean on. And that's sometimes a lot of clients too have questions. Like what was it like for you? Family acceptance, friends. Again, that same support, just providing different experiences, sharing those experiences, along with resources. A lot of times, if we form a group, we find that our males, because of course, there are more males that are with HIV, and a lot of times they will speak up and they do provide that support in different resources, or you can check here and if you're feeling this certain way. So I think that support is just, it's so important to have that support, to try to have a sponsor, sometimes to know different meetings, groups, resources. So that support is so valuable when you find people with HIV, so especially women.
Heather, did you have anything to add?
Yes, so I definitely agree with everyone that shared experience will definitely help um, with advocating for the women and girls living with HIV. The resources, sometimes they just don't know, and your shared stories will definitely help them, along the way. So
A sense of community is so important, whether that's a community of people that look like you, that have the same conditions as you, the people that think the same way as you. That's one of my biggest takeaways from this is I need to share much more. I know my friends always want to, but I need to keep sharing because everybody needs to hear that. Okay. And then, ooh, I got a question in the chat from Marty. Okay. If someone is married, should they still go get tested even if they're monogamous? That's a spicy question. What do you ladies think?
I say absolutely. If I could take on that one, absolutely. I think everybody, even if you're in a monogamous relationship and you know that you're married, I think everyone should get tested at least once a year. I tell everybody at least once a year, even if you're married. Because remember too that I mean, like you said, that's a little spicy. And I know sometimes people want to say my husband or my spouse don't cheat. But and they didn't go outside the marriage, or this didn't happen. And I was just tested last year. But I think it's just important to know your status and know it every year and just get tested every year. I just think that is so important, getting all your tests done every year, but definitely still getting your HIV test. So I think so. I'm a person that definitely is going to say so.
And I agree. I always tell my patients, only you know what you do 100% of the time. You are not responsible for anyone else's behavior and what those people are doing. And that's part of being a proactive participant in your care. I am a married woman and I get STD testing every year. It doesn't mean you suspect something. It doesn't mean you suspect infertility or your partner's treating. It's just taking the initiative to make sure that you're okay and that you know your status. And I advise my husband to do the same thing. Not that he suspects anything, but it's part of taking responsibility and taking initiative and making sure you're okay and you know your status. So yes, I am a very strong supporter, whether you're married or not, to making sure that you get tested at least once a year.
yeah, and just normalizing it, just normalizing HIV testing. Just it's a prevention screening test, just like any other test that you do when you go to the doctor's office, and just having normalizing the conversation around it, the discussion around it. So yeah.
I had something funny to add. I had a client once. This actually came up in a group, and a client was like, well, I'm married, and if I know what my husband had for breakfast, lunch, or dinner, should we still get tested? Absolutely. You can know what he had for breakfast, snack in between. And that's what people say. Well, they have snacks in between. And I was like, wow. But just being a supporter of getting tested, and like Heather said, yeah, normalizing that. Just like any other test. Let's normalize getting tested, no matter what. So we don't care if you knew what he had for breakfast, lunch, dinner, and snack. we want to normalize getting tested every year. So.
Absolutely. Please get tested.
And Laura,
Yes.
I would also add to that. I know when I first started practicing as a nurse practitioner, the clientele that I would see were kind of your teenagers, your adolescents, young adults. And I would do STD testing, regardless if they were married, if they were single, also on older patients, if they had not, gone years without getting tested. And I remember one of the providers I worked with, he came to me one day and he said, Dorian, I see that you're doing STD testing on this patient, but she's married. And I said, well, married women sometimes test positive for STDs. And then he was shocked one day that some of the tests came back positive. And he was shocked and he goes, but she was married. So even sometimes among providers, there's sometimes that misconception, or we feel like, okay, if someone is married, they don't need STD testing. So I just wanted to share that.
Yes, it's very applicable to everybody. If you're doing it, you need to go get tested.
Exactly.
I have two more questions. Well, one of them is not a question, but I feel strongly I need to read this. Alfonso says, each one of you are so knowledgeable and personable with your responses. Thank you so much for this conversation today. Thank you for being here. And thank you for
welcome. Thank you.
Thank
So
you for having me.
We always need more positive words and thoughts about ourselves. So I couldn't not read that. Thank you, Alfonso. And then the last question that we're going to do is, what social media platforms do you use to spread information? Do you feel we can do more to target women and bring awareness? Does anybody have any specialties in that?
I always feel like we can do more. I hate to say that, but I always feel like there's more. And I don't know if that's just challenging myself, because you always get a client that kind of challenges you, that just, we all have our little special situations that come in and really challenges us to do more. So I always feel like we can do more, whether in social media, especially now with our new normal and in this pandemic, getting people across. I love that when you said, Laura, we will mail these to your home. I did know of that, but just literally a month ago that you guys did that. And I hate that I felt like I was late on the bandwagon, because I could have been utilizing that. But when I heard it, it was so good to hear it, because it's just that there's and why I mentioned that is because you can always do more and you can always find a way. Okay, you embarrassed, don't worry about it. I'll mail it to your home, or you need the kit sent to you. I'll send that kit to your home and where you won't even know what it is. Or I just feel like that we're constantly always finding ways and different ways to do things. And I think that social media platform, I'm one myself that have been really looking lately to find out ways to innovative ways that we can get across on a better platform for us that way. Because before, we were very sociable, talking. Like I said, we were doing a lot of outreach. We love what we call going in the just getting in the gutter, that whole grassroots thing where we're just in the mix with you. And then all of a sudden, here comes a pandemic. So I am one that is actually looking for any more innovative ways like that we can actually reach more of our clients. Because like I said, a lot of with us is that some of our clients are, they're homeless. They don't have good addresses for us. So now as far as getting people vaccinating, where I can go back into those crisis centers and back out on the streets and be able to, if I have to take it to the home, say, hey, reach me out, on social media to get to me, that I can get those supplies and still bring them, but reach out via, social media, so that you don't have to feel like you have to come out because of the pandemic, or finding new ways, via social media to do different things like that. So I think that's interesting too, that we're looking to try to do that. So hopefully that'll happen with us.
Yeah, this pandemic definitely put the need to get information out virtually, because it's so hard not being able to talk to people and just meet people. Because I know that's how a lot of us function. It's just word of mouth, getting back on there.
Mm-hmm.
So absolutely. If that is all of the questions, I am going to wrap this up. Everybody, Make sure you got your screenshots of everybody's contact information. Thank you all so much for joining us, for being here for this conversation. And thank you ladies so much for having this conversation. It's so important to be able to just speak freely, to talk to everybody. And this is a very open place to be. If you guys need anything, reach out to these women, reach out to me, get that information, talk to your neighbors, go get tested, okay? So thank you so much. I hope you guys all have a beautiful and wonderful rest of your day. Keep wearing those masks, keep washing those hands. I'm ready to be back out doing stuff. Okay, thank you.
Thank you.
Thank you.